Dear ladies and gentlemen, thank you for joining us today and spending some time in the exciting world of AKRUS Medical Technologies. AKRUS is a German company and all of our products are being made in Germany. However, customers all over the world trust our quality. Today I would like to show you the superior features and functions of our SC5010 SEK surgical table. The product is perfectly designed for procedures in arthroscopy, orthopedics, general surgery, dermatology, and many other medical specialties. On our product familiarization tour, let's get started with the battery. All of our mobile surgical and examination chairs are driven by a very powerful 24-volt DC battery. Here's your battery, and this is the recharger unit. Out of a fully charged battery, you would expect 30 to 35 procedures, depending on your average weight of your patients. Once the battery is depleted down to approximately 20%, you will get a beeping warning sound if you hit any electric control button. Now remember, you still got 3 to 4 procedures in your current battery. However, with the next change of patient, it's also a good idea to change the battery. That will only take a few seconds. To remove the battery from the battery holder, just simply pull at the spring-loaded handle and pull the battery out of the holder. Use caution though, the battery is heavy. Use both hands, that avoids the battery dropping to the floor and causing some potential damage to it. To reinsert the battery, just simply set it up on the guides and push it in until you hear the audible click. The same holds true when you set up the battery on the recharger unit. Set up the battery on the rails and wait for the audible click. We do recommend to mount the battery to a wall in a vertical orientation. Gravity will help to press the electronic contacts firmly together so the recharging process will work properly. It will take approximately 4 hours to recharge the battery. You do not have to set a timer though to come back and pull it off. The electronic control unit will keep the battery between 95 and 98%. So the battery will not get overcharged and it will not get damaged. On this product, you will find the battery in this position. As I mentioned before, the chair is mobile. It is sitting on 4 heavy-duty dual casters. The casters and brakes are controlled by a brake lever on either side of the chair. With the brake lever being in a horizontal position, the chair moves freely into all directions and pivots on the spot and can be maneuvered even into tight corners. With the black arm of the chair being kicked down, the chair is firmly locked on the floor. Place your foot on the brake lever like so and firmly kick it down. With the green arm being kicked down, this wheel locks into the longitudinal position and provides directional control. Now you can turn the chair around tight corners. Now let's move on to the more specific features and functions of this chair. The chair offers 3 electric actuators. The up and down movement is electric. The backrest is electric. The seat cushion tilt is electric. The leg supports are manually adjustable. The chair also offers memory buttons. Now all actuators are moving simultaneously, which will speed up the process of positioning the chair. a shock position is available. The actuators are controlled by a handheld control unit or, as an option, by foot switches or foot joysticks. On the handheld control unit, you will find several pairs of buttons controlling the corresponding chair sections. You may press one or more buttons at the same time to speed up the movements. There are also 3 memory positions available on this panel. In order to save a position, drive the chair into the desired configuration and then press the S button, and within 5 seconds the M1, 2 or 3 button to memorize that position. The beeping sound will indicate that this position has been properly memorized. In order to call a memorized position, briefly press and let go the M button, and again within 5 seconds, press the M1 and 2 or 3 button until the chair has reached its desired position. The leg supports are manually adjustable. They pivot to the side if access between the ankles and lower limbs is required. They can be moved close together to form a single bore leg support, or they can be taken out altogether. To lift out the removable shoulder section, just simply unscrew the safety bolt in the back and lift out the part. You will notice the large access area from all different angles. Now we have covered the basics. In order to configure the surgical table to exactly meet your special needs, let's have a look at our many versatile and useful accessories. We offer various different headrests to ideally support and hold your patient's head during the procedure. Dual cushion headrest firmly holds in place the upper body of your patient under procedures under fully anesthesia. Standard headrest, preferred by ophthalmologists, but also good for any other procedure in the head area. Multi-articulated headrest allows to reposition patient's head during the procedure under sterile conditions. This allows the surgeon to maintain an upright posture, which eliminates any strain on the spine during that procedure. Both headrests are good for prone positions. A flat cushioned board, simple and efficient. You may want to use a donut to stabilize your patient's head. Gürtel supports for procedures in proctology, urology, and basic gynecology. Multi-articulated armrests can be set up on different angles for maximum patient comfort. Radial loosened arm extension table, height adjustable, with a very wide board for patient's arm and some instruments. A mechanical knee clamp holds patient's leg in a fixed position. An electrical knee clamp allows adjustments during the procedure. Safety railings on either side of the seat cushion. Foot switchers placed either inside the tray or on the floor. They control the up and down movement of the chair and the backrest. The electric knee clamp is a very useful accessory in all kinds of knee procedures. The foot switches can be freely positioned on the floor. The arrows on the switches are self-explanatory. Before you start your knee procedures, place your patient's thigh inside the knee clamp. One wing is moving freely, the other wing is either fixed or moves freely as the counterpart. To fix the leg, just slide the Velcro strip through the notch and tighten it securely. The knee clamp moves from an almost horizontal position all the way up to 45 degrees. If the pivoting point is lined up with your trochanter major, the up or down movements will not cause any changes on the angle of the knee clamp on the thigh. Ladies and gentlemen, I hope this video has helped to show and demonstrate the functions and advanced features of our product. I thank you for your attention.